What are my fertility options after bone cancer? Facing the possibility of fertility changes after bone cancer can feel overwhelming, but understanding your options can help you plan for the future. Bone cancer treatments often involve chemotherapy, radiation, and sometimes surgery, all of which can impact fertility in both men and women. The extent of this impact depends on the type and dose of treatment, the area treated, and your age at the time of therapy. Chemotherapy drugs used for bone cancer, especially alkylating agents like ifosfamide, are known to reduce sperm production in men and can damage ovarian reserve in women. Men are generally more affected, but women can also experience decreased fertility. Radiation therapy directed at the pelvic area or reproductive organs can harm sperm-producing cells or ovarian follicles, increasing the risk of infertility. Surgery involving reproductive organs or nearby tissues may also influence your ability to conceive, depending on how much tissue is removed or affected. The best time to consider fertility preservation is before starting treatment. For men, sperm banking is a straightforward and effective method. It involves collecting and freezing sperm for future use. Women have options like egg freezing, where eggs are harvested after hormonal stimulation and stored for later use, or embryo freezing if you have a partner or donor sperm available. These procedures typically take a few weeks and should be planned early. If radiation is part of your treatment plan near the pelvis, ovarian transposition might be considered. This surgical procedure moves the ovaries out of the radiation field to help preserve ovarian function. If fertility is affected after treatment, assisted reproductive technologies can help. In vitro fertilization is a common approach, especially if you have preserved eggs, sperm, or embryos beforehand. If no gametes were preserved, using donor eggs, sperm, or embryos is an option. For those who cannot carry a pregnancy due to medical reasons, gestational surrogacy is another pathway. Adoption remains a meaningful and fulfilling way to build a family, offering an alternative route to parenthood. Recovery of fertility varies from person to person. Some men may regain sperm production years after chemotherapy, but others might need to rely on donor sperm. Women's fertility is closely tied to age, as ovarian reserve naturally declines over time, and treatment can accelerate this process. Fertility treatments after cancer may be less successful than in the general population, which underscores the importance of early preservation efforts. Emotional and psychological support is also vital, as facing fertility challenges can be stressful and emotional. All patients should have thorough counseling about fertility risks and preservation options before beginning treatment. Fertility specialists can help create personalized plans based on your specific treatment, age, and reproductive goals. Regular follow-up with your oncology and fertility teams can help manage long-term health and reproductive outcomes. In summary, your fertility options after bone cancer depend heavily on whether you preserved your fertility beforehand and how your treatment affected your reproductive organs. Early consultation with fertility experts is key to maximizing your chances of future parenthood. Post-treatment options include assisted reproductive technologies, donor gametes, surrogacy, and adoption. Remember, every person's journey is unique, so personalized medical advice is essential to navigate your options confidently.